Hi, it's Dr. Lowenstein here in Santa Barbara, and I just want to briefly talk about using a breast implant and a lift at the same time. It's very commonly done. There are operations that can be done completely separately in women who just need a lift or just need a breast implant. But in a lot of women, putting a little implant in at the same time as the lift allows for kind of an enhancement of the outcome. When we do a breast lift in people who are really droopy, it tends to bring the breast tissue back higher up on the chest wall, but having volume in the upper pole is a very difficult thing without an implant. Utilizing your own breast tissue, gravity still tends to want to do its thing, and so that brings the majority of the tissue up towards the apex of the breast, but you'll often still have not really a ski slope, but a sort of deficiency of tissue in the upper pole. And the way to create a teardrop shape is to place a small implant in the pocket behind the breast lift. And it doesn't have to be necessarily a big implant. We can also really increase the size of your breast if you'd like to put a significant sized implant in, but even a small implant can help with shaping the breast, and that's the usual utility for that situation. The incision for the implant placement is underneath the breast, just like all of my other breast augmentation operations, and that's done because it has the lowest risks for capsular contracture or problematic scarring. The implant's placed to provide that volume, and then the lift is done over the implant to give a really nice shape, and we've had a lot of success with that. Again, not absolutely necessary. Many women can do very well without an implant, but sometimes people have questions about whether or not they can have an implant at the same time as a lift, or if it's even a good idea. And the answer to both of those questions is yes. The other option to remember is that they don't, even if you need or want both, they don't have to be done at the same time. You can do a lift, evaluate the situation, and if you want to add volume to the upper pole later, a small implant can be placed at that time. So it's not really something where you're burning bridges if you don't do it at the same time, but you should know that it's not only very possible, but very commonly done. All right, thanks again. Adam Lowenstein in Santa Barbara. Always feel free to give us a call with any questions that we can help you with. Take care.